Good morning, everybody. We are thrilled to have you here today, gathering in Boston. The windows are closed, but it is a glorious, sunny, 70 degrees outside, as it always is here. We're thrilled to gather with you here in Boston. And for STAT, it's our third year collaborating with The Atlantic for Pulse to have these really fascinating conversations that we've been enjoying all morning. Before we begin the next session, I'm going to provide a little background on who we are. And as a little teaser, the next session involves a fantastic film. We launched STAT nearly 4 years ago as an all-digital sister publication to the Boston Globe. Our notion was that Boston is the epicenter of so many vital stories about health, medicine, and science that would be of interest to readers not only here, but around the world. So we've built a wide, broad following with a quarter of our readers international and large audiences in California, New York, and yes, here in Massachusetts. I'm always humbled in my travels here and abroad when leaders of these fields come up and tell me that how STAT has become a must-read for their company. And while STAT is based here, we have reporters in the cities that were of the other epicenters around the country, including DC, New York, San Francisco, and LA, with many of the most respected journalists in the business. With vivid multimedia like you're about to witness, we take our readers inside science labs and hospitals, biotech boardrooms, and political backrooms. We dissect crucial discoveries. We hold individuals and institutions accountable. We introduce you to the power brokers and personalities who are driving a revolution in human health. We are telling the stories that matter to you. I'd encourage you to sign up for our free curated newsletters. My favorites are the morning rounds, which come to you each morning, tell you everything you need to know, and Boston Briefly, which is our weekly newsletter with stories about health and medicine in this city. We're glad that some of these stories can be brought to you live today here in Boston on the front lines of healthcare. This morning, we all started the day here with a national conversation on the state of healthcare in the country. We'll now turn our attention to the opioid epidemic. We have two panels, including one that takes you inside STAT's 3+ year legal battle with Purdue Pharma for documents that shed light on the marketing of OxyContin. But first, here's a clip from Runnin', an award-winning STAT original documentary that provides an intimate and heartbreaking look at the opioid crisis in the community of Somerville, which is, you can also see from these windows, in the individuals, families, and communities that it affects. Enjoy.
Alex was a talented basketball player with a big heart. Unlike my other friends, his drug addiction started after high school.
He was empathetic. He cared about people. If he found an injured animal, he'd bring it home to take care of it. And one day he made me drive at rush hour to the animal hospital in Boston with an injured squirrel.
He was a truly gifted athlete. He was 6'5" in high school, left-handed. One thing that did come from his sports career was anxiety. Coach Malillo was his coach. Mike, your son is the best kid ever I've had in 17 years at practice. Click, the clock starts, he becomes passive. He wouldn't do what he knew he could do. I think that was the seed, whatever anxiety disorder he might have possessed. The first time you taste the opioid, all that anxiety goes away. He used to come home sometimes when I kind of knew he had been using and say, I really feel good. Where most of the time after he was 15, 16 years old, if he was home, he was headsets, sullen, don't touch me, don't talk to me.
I didn't know anything about drugs or addiction. A couple of times our daughters would say, can't you tell that he's high? No, I can't. I thought he was in a good mood. You know, eventually you learn more, but the first thing I remember noticing, and opening the kitchen drawer and saying, where on earth are all the spoons? It's kind of one of those things that when they teach you about addiction and keeping your kids safe, that's probably the first thing they should tell you. If your spoons are disappearing, you have a problem.